Welcome to the 2023 HESI A2 practice test. This test will have 60 questions with explained answers that will help you prepare for the test. Be sure to resuscitate the like button by turning it white.
Question 1. Which of the following fractions is closest to 5/8 without going over? A. 7/16, B. 9/12, C. 7/11, D. 2/5. The correct answer is A. 7/16. 5/8 equals 0.625. 7/16 equals 0.438. 9/12 equals 0.75. 7/11 equals 0.636. 2/5 equals 0.4. 7/16 is closest without going over. Question 2. John is on a weight loss journey. His bariatric physician told him that in order to qualify for the gastric sleeve surgery, he must lose 2.5% of his starting weight before the surgery can be performed. John's starting weight is 244 kilograms. How many pounds of weight must John lose in order to qualify for the gastric sleeve surgery? Remember, there are 2.2 pounds in each kilogram. A. 13, B. 14.24, C. 13.42, D. 15.32. The correct answer is C. 13.42. 244 kilograms times 2.2 pounds equals 536.8 pounds, John's starting weight. 536.8 times 2.5% equals 13.42 pounds needed to lose to qualify for gastric sleeve surgery. Question 3. Braden spent $12.50 on lunch in the hospital cafeteria during his first week of work. The next week, he spent $17.60 on his lunch. The next 2 weeks, Braden spent $33.45 on lunch in the cafeteria. What is the average expenditure on lunch each week over the last 4 weeks? A. $63.55, B. $15.89, C. $31.78, D. $47.66. The correct answer is B. $15.89. Total lunch cost over 4 weeks equals $63.55. $63.55 divided by 4 weeks equals $15.89 average per week. Question 4. 568.34 plus 834.345 equals A. 1,402.69, B. 1,401.79, C. 1,396.81, D. 1,397.98. The correct answer is A. 1,402.69. The sum of the two integers is 1,402.69. Question 5. Susan is on a weight loss journey. After 6 weeks, Susan lost 5% of her total body weight. If Susan's starting body weight was 187 pounds, how many pounds did Susan lose after 6 weeks? A. 8.75, B. 5.75, C. 9.35, D. 7.75. The correct answer is C. 9.35. 187 times 5% equals 9.35, or 187 times 5 divided by 100 equals 935 divided by 100. And move the decimal from 935.00 over 2 spaces to make 9.35. Question 6. Amy is baking a cake. Amy needs 4 eggs for every 2 pounds of cake that she makes. If Amy has 56 eggs, how many pounds of cake can she make? A. 18, B. 28, C. 32, D. 16. The correct answer is B. 28. 56 eggs divided by 4 eggs means that Amy can make 14 cakes. Each cake is 2 pounds. 14 times 2 equals 28 pounds. Question 7. Kate is working at a flu shot clinic today. She administered a total of 1,567 flu shots over a 14.25-hour period. How many flu shots did Kate average giving per hour? Round to the nearest whole number. A. 110. B. 109. C. 111. D. 114. The correct answer is A. 110. 1,567 shots divided by 14.25 hours equals 109.96. Rounded to the nearest whole number equals 110. Question 8. How many inches are in 3 feet? A. 24. B. 36. C. 118. D. 28. The correct answer is B. 36. There are 12 inches in a foot, therefore 12 times 3 equals 36 inches. Question 9. What is the equivalent to 0.0000003? A. 0.0000003%. B. 0.3%. C. 0.003%. D. 0.00003%. The correct answer is D. 0.00003%. When converting a decimal to a percentage, the decimal is moved 2 spaces to the right. Therefore, 0.0000003 equals 0.00003%, or 0.0000003 times 100 equals 0.00003%. Question 10. 4/5 times 9/8 equals A. 9/10, B. 4/5, C. 3/8, D. 1/2. The correct answer is A. 9/10. 4/5 times 9/8 equals 36/40. Divide 36 divided by 4 and 40 divided by 4 to get 9/10. Question 11. 3/4 times 11/10 equals A. 0.75, B. 0.925, C. 0.875, D. 0.825. The correct answer is D. 0.825. 3/4 times 11/10 equals 33/40. 33 divided by 40 equals 0.825. Question 12. There are 256 candies in a jar. Approximately 67% of the candies are red and the rest are green. How many green candies are in the jar? Round to the nearest whole number. A. 67. B. 85. C. 48. D. 72. The correct answer is B. 85. 100% minus 67% will give you the percentage of green candies, which is 33%. There is a total of 256 candies. 256 times 33% equals 84.48, or rounded equals 85. Question 13. The patient is having a biopsy done today. What is the meaning of the underlined word? A. To take an image. B. To take a sample. C. To make bigger. D. To make spasm. The correct answer is B. To take a sample. A biopsy occurs when a healthcare provider, IDMD, takes a sample and sends the sample to pathology. Therefore, a biopsy means to take a sample. Question 14. The patient's test results came back malignant. What is the meaning of the underlined word? A. Cancerous. B. Benign. C. Healthy. D. Unconcerning. The correct answer is A. Cancerous. Malignant refers to cancer. Malignant cells are unhealthy, concerning cells that have been invaded by cancer and may spread to other parts of the body. Question 15. The patient was in a supine position. What is the meaning of the underlined word? A. Sitting, B. Standing, C. Lying, D. Sideways. The correct answer is C. Lying. Supine means on the back. Therefore, if the patient is in a supine position, he or she is in a lying position. Question 16. The patient is having a cholecystectomy. What does the suffix ectomy refer to? A. To cut out, B. To replace, C. To heal, D. To fix. The correct answer is A. To cut out. Ectomy refers to the cutting out of. The word cholecystectomy has the suffix ectomy. You can conclude that the patient is having something cut out during his procedure. Question 17. The nurse studied genealogy. The suffix ology refers to what? A. The cutting out, B. The repairing of, C. The study of, D. The disease process of. The correct answer is C. The study of. The suffix ology refers to the study of. Here, genealogy means the study of genes. Question 18. The patient is seeing a pulmonologist. What does the prefix pulmo refer to? A. Stomach, B. Heart, C. Bones, D. Lungs. The correct answer is D. Lungs. The prefix pulmo refers to the lungs. Further, ologist refers to the one who studies. Placing these two words together, one can conclude that a pulmonologist is one who studies the lungs. Question 19. The nurse explained to the patient that his doctor made him strict NPO, nothing by mouth. What does the term strict refer to? A. Nonchalant, B. Unconcerned, C. Absolute, D. Apathetic. The correct answer is C. Absolute. Strict means absolute. This patient's doctor placed him on a strict diet of nothing by mouth. This means the patient has to have absolutely nothing by mouth. Question 20. The nurse ensured that the IV line was patent before she started the patient's infusion. What is the meaning of the word patent? A. Available, B. Clogged, C. Clamped, D. Inconspicuous. The correct answer is A. Available. Patent means available or rights granted. The nurse here is ensuring that the IV line works before starting an infusion that will infuse into the IV. Question 21. The patient came into the ER with a lethal amount of medication in his system. What does the term lethal mean? A. Small, B. Inconsistent, C. Deadly, D. Incompetent. The correct answer is C. Deadly. Lethal refers to the word deadly. This patient came into the ER with a deadly amount of medication in his system. Question 22. The patient reports being inebriated last night. What does the term inebriated mean? A. Sleepy, B. Drunk, C. Excited, D. Depressed. The correct answer is B. Drunk. Inebriated means intoxicated or drunk. The other options here do not refer to an inebriated state. Question 23. In the following sentence, which word is a noun? The dog jumped into the water to fetch the ball. A. Dog, B. Fetch, C. Into, D. Jumped. The correct answer is A. Dog. A noun is a person, place, or time. The nouns in the sentence is dog, water, and ball. However, only dog is listed as an option to choose from. Question 24. In the following sentence, which word is a pronoun? He put on his hat to prevent his ears from getting cold. A. Hat, B. Cold, C. He, D. Put. The correct answer is C. He. A pronoun can function alone. It refers to something or someone. In this sentence, he is the pronoun. Question 25. In the following sentence, which word is an adjective? The boy ran quickly to school. A. Quickly, B. School, C. Boy, D. Ran. The correct answer is A. Quickly. An adjective explains how a verb was done. In other words, how was something done? In the sentence, the boy ran, verb. How did the boy run? The boy ran quickly. Quickly is the adjective. Question 26. In the following sentence, which word is a preposition? The girl stood on the log for a long time. A. Girl. B. Stood. C. Log. D. On. The correct answer is D. On. A preposition is a word or group of words used before a noun, pronoun, or noun phrase to show direction, time, place, location, spatial relationships, or to introduce an object. In this sentence, on is the preposition. Question 27. Select the best word for the blank in the following sentence. Florida has blank palm trees than Arkansas does. A. More. B. Fewest. C. Most. D. Lesser. The correct answer is A. More. The correct word to use here is more. More is the word in the sentence used to describe the countable noun, palm trees. Question 28. Which of the following sentences is grammatically correct? A. She has more candy than me. B. She has more candy than we. C. She has lesser candy than I. D. She has lesser candy than me. The correct answer is A. She has more candy than me. The grammatically correct sentence here is, she has more candy than me. Lesser is not a proper term in grammar. Question 29. Which of the following sentences is grammatically correct? A. She had all green candies except for one. B. She had all green candies except for one. C. She had all green candies except for one. D. She had all green candies except for one. The correct answer is A. She had all green candies except for one. Except means including all but. The term accept means to give consent. Read this sentence. She had all green candies to give consent for one. This sentence does not make sense. Reading the sentence as, her candy included all but one green one, makes a lot more sense when reading the sentence. Question 30. Which word is the best option to fill in the blank? To blank should I send my money to? A. Who. B. Whom. C. Whose. D. Whose. The correct answer is B. Whom. The word who is a subject pronoun and the word whom is the object pronoun. In this sentence, one would use the object pronoun. Question 31. Which word in the following sentence is a conjunction? Susan is on a new diet to help her lose weight, but she is not enjoying the diet. A. Susan. B. New. C. But. D. She. The correct answer is C. But. A conjunction is a word that joins together sentences, clauses, phrases, or words. The only conjunction in the above sentence is but. Question 32. Select the best words for the blanks in the following sentence. The bird sings blank song each morning and the man thinks blank a beautiful song. A. It's, it apostrophe S. B. It's apostrophe, it's. C. It apostrophe S, its. D. It's apostrophe, it apostrophe S. The correct answer is A. It's, it apostrophe S. It's means belonging to. It apostrophe S means it is. If one were to read the sentence, the bird sings its song each morning and the man thinks it is a beautiful song, the sentence makes sense. The song belongs to the bird. Question 33. Which of the following catalyzes chemical reaction? A. Proteins. B. Fats. C. Carbohydrates. D. Enzymes. The correct answer is D. Enzymes. By lowering the activation energy and consequently raising the rate of reaction, enzymes and other catalysts work. Since both directions must travel through the same transition state, The increased rate is the same in both the forward and reverse directions. Question 34. What is the smallest type of biological molecules? A. Monomer. B. Amino acids. C. Nucleic acids. D. Nucleotides. The correct answer is A. Monomer. A monomer is the common name for a single component or bead. Our cells are made up of strings of monomers, which are the building blocks of all biomolecules. For instance, nucleic acids are strings of nucleotides, and proteins are composed of strings of amino acids. Question 35. Which of the following describes a process by which a cell uses the cell membrane to engulf a particle? A. Mitosis. B. Glycolysis. C. Nucleosis. D. Phagocytosis. The correct answer is D. Phagocytosis. Phagocytosis occurs when a cell utilizes the cell membrane to engulf a particle. Cells performing this function are known as phagocytes. Question 36. Which organ in the body stores red blood cells in the event that the body needs those cells? A. Liver. B. Kidneys. C. Heart. D. Spleen. The correct answer is D. Spleen. In the event of an emergency, extra red blood cells are primarily stored in the spleen. At any given time, the spleen stores up to 30% of the body's red blood cells. The destruction of worn-out or damaged red blood cells is another function of the spleen. Upper left abdominal quadrant is where the spleen is situated. Question 37. White blood cells include all of the following except A. Monocytes. B. Leukocytes. C. Basophils. D. Thrombocytes. The correct answer is D. Thrombocytes. Our blood contains platelets, also known as thrombocytes, which are tiny, colorless cell fragments that help to stop or slow bleeding. Our bone marrow, the sponge-like tissue found inside our bones, is where platelets are created. Question 38. What is the term for the growth plates located in the body? A. Epiphyseal plates. B. Metaphysis plates. C. Metamorphosis. D. Cartilage. The correct answer is A. Epiphyseal plates. Long bones grow in the growth plate, sometimes referred to as the epiphyseal plate, which is a thin cartilage layer located between the epiphysis and the metaphysis. The primary location for the long bones' longitudinal growth is the epiphyseal growth plate. At this location, cells proliferate, enlarge, and produce the characteristic extracellular matrix, resulting in the formation of cartilage. Following formation, the cartilage is destroyed, hardened, and replaced by osseous tissue. Arkansas requires the registered nurse to have a minimum of a master's degree in nursing to be eligible to sit for the board exam to obtain an APRN license. Specifically for the adult gerontology APRN, the nurse should have a minimum of 500 practicum hours. The registered nurse should also have a minimum of 2,000 hours as an RN either in Arkansas or in a compact state. Both classroom and practicum hours are required for the APRN license. The school in which the RN attends must be accredited by the Commission on Collegiate Nursing Education. The Arkansas State Board of Nursing recognizes the CNP, CRNA, CNM, and CNS. For prescriptive authority, a minimum of 3 semester hours or 45 contact hours are required in pharmacokinetics principles and practical application. To be considered for APRN licensure in Arkansas, the registered nurse must first hold an RN license. The nurse must always hold both a RN and APRN license to practice as an APRN. Specifically for the adult gerontology APRN, there is a minimum requirement of 500 practicum hours and 75 continuing education hours during each 5-year period. The continuing education hours must be in pharmacology, physical assessment, and physiology. The Arkansas State Board of Nursing is the regulator of all nurses in Arkansas. Their goal is to provide safe care to all patients. The Arkansas State Board of Nursing works in collaboration with the American Medical Association to ensure that all nurse practitioners are working within their scope of practice under an MD that is licensed under the Arkansas Medical Practice Act. Arkansas allows for limited nurse practitioner practice. This means that the nurse practitioner in Arkansas must work under a medical doctor. Because the APRN is only allowed to prescribe Schedule 3 to 5 drugs, some patients may have to make an appointment with the physician if they need drugs outside of this scope. An example of a medication not approved for the APRN to prescribe is Dilaudid or Demerol. When it comes to prescriptive authority in Arkansas, the APRN must apply for prescriptive authority separately. A DEA certificate must be acquired by the APRN until one receives the full APRN license. The DEA certificate number is needed if the APRN plans to prescribe controlled substances. To prescribe any medications, the APRN must complete a 300-hour preceptorship and must hold a collaborative agreement with a medical doctor who is licensed under the Arkansas Medical Practice Act. The APRN is only allowed to prescribe medications that fall under a Schedule 3 to 5. Medications that fall under Schedule 1 to 2 are prohibited for the APRN to prescribe. The APRN must have extra continuing education hours every 2-year period to continue to hold prescriptive authority in Arkansas. Question 39. According to the accompanying text, the APRN, Advanced Practice Registered Nurse, must have how many practicum hours to be able to take the board exam? A. 400, B. 500, C. 600, D. 750. The correct answer is B. 500. The text states that the APRN must obtain a minimum of 500 practicum hours to be able to take the board exam to receive an APRN license. Further, the nurse should have worked at least 2,000 hours as an RN to be able to sit for the exam. Question 40. According to the accompanying text, the school that the RN decided to attend must be accredited by whom in order for the RN to receive an APRN license? A. The State Board of Nursing. B. Arkansas Medical Practice Act. C. Commission on Collegiate Nursing Education. D. Drug Enforcement Agency, DEA. The correct answer is C. Commission on Collegiate Nursing Education. The text states that the school in which the RN attends must be accredited by the Commission on Collegiate Nursing Education. The Arkansas State Board of Nursing is the regulator of all nurses in Arkansas. Question 41. According to the accompanying text, in order for the nurse to obtain prescriptive authority as an APRN, the nurse must engage in how many contact hours in pharmacokinetics? A. 3, B. 15, C. 90, D. 45. The correct answer is D. 45. For prescriptive authority, a minimum of 3 semester hours or 45 contact hours are required in pharmacokinetics principles and practical application. To be considered for APRN licensure in Arkansas, the registered nurse must first hold an RN license. Question 42. According to the accompanying text, how many hours of continuing education does the APRN in gerontology need to obtain each 5-year period in order to keep their APRN license up to date? A. 15, B. 45, C. 75, D. 60. The correct answer is C. 75. Specifically for the adult gerontology APRN, there is a minimum requirement of 500 practicum hours and 75 continuing education hours during each 5-year period. The continuing education hours must be in pharmacology, physical assessment, and physiology. Question 43. According to the accompanying text, what is the goal of the Arkansas State Board of Nursing? A. Culturally safety. B. Patient education. C. Safe care to all patients. D. Cultural humility. The correct answer is C. Safe care to all patients. The Arkansas State Board of Nursing is the regulator of all nurses in Arkansas. While all of the above answers are important, the ARSBN's goal is to provide safe care to all patients. Question 44. According to the accompanying text, the APRN is not allowed to prescribe what schedule of drugs? A. 3, B. 4, C. 2, D. 5. The correct answer is C. 2. Because the APRN is only allowed to prescribe Schedule 3 to 5 drugs, some patients may have to make an appointment with the physician if they need drugs outside of this scope. In Arkansas, the APRN must work under a medical doctor, MD. Question 45. According to the accompanying text, an APRN working in Arkansas must work under a MD medical doctor that is licensed by whom? A. Arkansas Medical Practice Act. B. Arkansas State Board of Nursing. C. Commission on Collegiate Doctoral Education. D. Drug Enforcement Agency, DEA. The correct answer is A. Arkansas Medical Practice Act. The Arkansas State Board of Nursing works in collaboration with the American Medical Association to ensure that all nurse practitioners are working within their scope of practice under an MD that is licensed under the Arkansas Medical Practice Act. Arkansas allows for limited nurse practitioner practice. Question 46. According to the accompanying text, the APRN must complete how many hours of preceptorship with an MD to be able to prescribe medications in Arkansas? A. 150, B. 700, C. 300, D. 550. The correct answer is C. 300. To prescribe any medications, the APRN must complete a 300-hour preceptorship and must hold a collaborative agreement with a medical doctor who is licensed under the Arkansas Medical Practice Act. The APRN must have extra continuing education hours every 2-year period to continue to hold prescriptive authority in Arkansas. Pain, increased medications, and functional decline include just a few of the concerns that the nurse practitioner should acknowledge in the geriatric adult population. In healthcare, there are 3 outcomes that are imperative to the effectiveness of care: better care for patients, increased health for patients, and decreased cost of healthcare. No matter the outcome of care, the care provided is only effective if it matters to the patient and is beneficial to the patient. The care of a patient should be value-based. When outcomes are measured and reported, it fosters improvement and adoption of best practices, thus further improving outcomes. To ensure effectiveness of care for patients, healthcare providers should implement the following 3 interventions: assess pain, assess and reconcile medications, and observe functional decline. As patients age, pain is inevitable. As a nurse practitioner, it is imperative to assess pain of the patient in order to promote a good quality of life for the patient. Pain is severely undertreated in the geriatric population due to the fear of opioid dependence and the idea that pain is a normal part of aging. Because pain is undertreated, the geriatric population is prone to depression due to untreated pain, falls, slower recovery after a fall or surgery, desocialization, and higher healthcare costs overall. Pain is the 5th vital sign and should be assessed accordingly. However, because the geriatric population is prone to dementia and impaired cognition, pain can be hard to assess for the healthcare professional. When patients feel heard by the medical professional, a rapport can be established between the patient and the medical professional. Rapport can lead to better pain management, which in turn leads to a better quality of life for the patient. This cycle ultimately results in improved patient ratings. When it comes to the fear of opioid addiction, education provided to the patient about opioid addiction is imperative. Furthermore, addressing cost savings, if the patient's pain is being controlled effectively, the patient is not going to come into the office multiple times addressing uncontrolled pain. Also, mentioned above is the uncontrolled pain that can lead to more falls in the older adult. If the patient falls and breaks a bone, they may need surgery, which is a major cost. The cycle can be vicious. Ensuring an adequate pain management regimen can significantly cut down on cost. Question 47. According to the accompanying text, the care provided is only effective if A. Both the doctor and patient agree upon a treatment plan. C. A patient's health care plan is cost efficient. C. If it matters to the patient. D. The patient has an increased quality of life. The correct answer is C. If it matters to the patient. In healthcare, there are 3 outcomes that are imperative to the effectiveness of care: better care for patients, increased health for patients, and decreased cost of health care. No matter the outcome of care, the care provided is only effective if it matters to the patient and is beneficial to the patient. While the other options above are important, the text specifically relates answer C to effective care. Question 48. According to the accompanying text, to ensure effectiveness of care for patients, healthcare providers should implement all of the following except A. Assess pain. B. Assess and reconcile medications. C. Observe functional decline. D. Assess the patient's ability to feel pain. The correct answer is D. Assess the patient's ability to feel pain. According to the text, to ensure effectiveness of care for patients, healthcare providers should implement the following 3 interventions: assess pain, assess and reconcile medications, and observe functional decline. While D is a good option to assess, this is not listed in the accompanying text. Question 49. What term defines the mass-weighted average of the isotope masses that make up an element? A. Atomic mass. B. Cell mass. C. Atomic radius. D. Base radius. The correct answer is A. Atomic mass. The mass of each isotope is multiplied by its abundance to produce the atomic mass, which is a weighted average of all the isotopes of that element. The sum of an element's mass number and its number of protons and neutrons is given by the formula mass number equals protons plus neutrons. Question 50. What is the name of the law that connects particle count to volume? A. Boyle's law. B. Charles's law. C. Doyle's law. D. Avogadro's law. The correct answer is D. Avogadro's law. According to Avogadro's law, the total number of atoms or molecules in any gas is inversely correlated with the volume of that gas occupied at constant pressure and temperature. V equals Kn, or V1 divided by N1 equals V2 divided by N2, is how Avogadro's equation is expressed. Question 51. What term defines the maximum strength of strong acid or basic that a buffer can withstand? A. Buffer capacity. B. Calorimetry. C. Bond order. D. Bond energy. The correct answer is A. Buffer capacity. Buffer capacity is a unitless quantity that is calculated by dividing the amount of an acid or base required to raise the pH of a solution by 1 by the pH change and the volume of buffer in liters. By consuming the buffer, a buffer prevents pH changes caused by the addition of an acid or base. Question 52. What term defines a functional group made up of an OH group and a carbonyl group? A. Carbonyl group. B. Carboxylate ion. C. Carboxyl group. D. Catalyst. The correct answer is C. Carboxyl group. Carboxyl groups, also known as hydroxyl, single-bonded OH, and carbonyl, double-bonded O groups, are made up of 2 functional groups that are joined to a single carbon atom. The carbonyl group, C equals O, and the hydroxyl group are what give the carboxyl, COOH group, its name. They consist of amino acids and carboxylic acids. Question 53. What term defines the affiliation of 2 atoms within a molecule? A. Chemical bond. B. Non-chemical bond. C. Atomic bond. D. Chemical change. The correct answer is A. Chemical bond. Atoms are bound together by bonds known as chemical bonds. The power that holds ions or molecules together is this force. It aids the synthesis of a chemical molecule. Water, sodium chloride, and carbon dioxide are a few examples of the chemical substances that are particularly interesting to biologists. Question 54. Which term defines the transformation of a gas into a liquid? A. Condensation. B. Conversion. C. Liquefy. D. Critical point. The correct answer is A. Condensation. The opposite of vaporization, condensation is the transition of a substance from its gaseous to its liquid state. The term can also refer to cloud condensation nuclei in the atmosphere or the transformation of water vapor into liquid water when in contact with a liquid or solid surface. The term cycle most frequently refers to the water cycle. Deposition is the term used to describe a change that occurs when a solid phase immediately changes from a gaseous phase. Question 55. Which of the following areas does cervical refer to? A. Neck. B. Foot. C. Back. D. Arm. The correct answer is A. Neck. The neck portion of the spinal column or backbone is called the cervical spine. The first 7 bones make up this structure, C1 to C7. The intervertebral disc, spinal cord, nerves, muscles, tendons, and ligaments are other structures in or near the cervical spine. Question 56. If a person has O-negative blood, which of the following blood types may this patient receive? A. O-negative. B. AB negative. C. A negative. D. B negative. The correct answer is A. O negative. Blood type O negative individuals are referred to as universal donors. A person with type O negative blood, however, cannot acquire any other blood types and must receive O negative blood. Question 58. After blood in the heart leaves the right atrium, where does it travel next? A. Right ventricle. B. Left ventricle. C. Superior vena cava. D. Aorta. The correct answer is A. Right ventricle. Blood leaving the right atrium travels to the right ventricle. Question 57. What is the correct term for the connective tissue in the body that connects bone to bone? A. Ligaments. B. Cartilage. C. Joints. D. Tendon. The correct answer is A. Ligaments. Ligaments frequently bind 2 bones together, notably in joints. They support the joint or keep the ends of the 2 bones together like strong, securely fastened straps or ropes. By doing this, it is prevented that the bones in the joint would twist or separate abnormally and become dislocated. Question 59. What is the name of the muscle responsible for breathing? A. Diaphragm. B. Thorax. C. Larynx. D. Sternum. The correct answer is A. Diaphragm. The diaphragm, rib cage muscles, and abdominal muscles make up the 3 functional categories of respiratory muscles. Each group affects the chest wall and its compartments, the rib cage adjacent to the lung, the rib cage adjacent to the diaphragm, and the abdomen. Question 60. Which of the following is not associated with the frontal lobe of the brain? A. Judgment. B. Social behavior. C. Planning. D. Processing auditory information. The correct answer is D. Processing auditory information. The frontal lobe plays a number of important jobs and is located just beyond the forehead. These include memory, decision-making, abstract reasoning, creativity, social appropriateness, and voluntary movement tasks.
Thank you for watching this video. We hope you enjoyed it. Check out these other videos that can help you with your future studies. Don't forget to resuscitate the like button and subscribe to our channel, and please share this video with your fellow nursing friends.